Welcome to an episode of Nye the Science Gal. Today, we're going to be talking about local anesthesia.
Bill Nye the Science Guy.
Science rules. Chill.
Bill Nye the Science Guy.
So what even is local anesthesia?
Jill?
Local anesthesia is a sedative drug that decreases activity, moderates excitement, and calms the recipient. Local anesthesia has been around for a really long time. Not that long. It was introduced by the Sumerians in 9000 BC as fermented beverages. Oh. So what local anesthesias are we going to be talking about today? Well, let me tell ya. IV sedation. Oral sedation. General anesthesia. Electric anesthesia. Let's go into more depth about these, shall we? Before we get started, we're going to be talking about two different pain-relieving drugs. What's the difference between anesthetics and analgesia? I'm going to call one of my friends to come help me out. Hannah? Thanks for coming, Hannah.
Anytime!
So I just have a question for you. Do you know the difference between analgesia, analgesics, and anesthesia?
Sorry, you guys. I think so. Yeah, I should.
Here, what are they?
So analgesia is the relief of pain without total loss of feeling. So you can still kind of feel a little bit, but you are pretty numb. And then the anesthesia is a blocking of full feeling. So you can't feel anything at all, such as general anesthesia and things like that, which you'll probably go over later today, I'm sure. And then,
So, can you tell me some examples of anesthetic and analgesia?
yeah, so the analgesia is offered to women after labor or after surgery or delivery, so not during it. And then the anesthesia is actually offered to women who are going through a C-section or things like that, to where it's completely numb and they can't feel it when they get cut open.
Wow. Interesting. Well, thanks for letting us know more about those.
Anytime.
Have a great day.
Poof me in.
Great! Now that we've gone over those two pain-relieving drugs, let's go into more detail about the rest of the local anesthetics.
So I'm just going to be giving you a shot, and it's just going to knock you out for a while so that when we go in to cut open your stomach and break some of your bones and whatever else needs to be done in there, then we're good, okay? Wait!
Oh! Veronica is in the other room right now, telling her patient about general anesthesia. Let's go check out what she has to say.
Okay, so what exactly is general anesthesia?
So what general anesthesia is pretty much we use some drugs to help it pretty much puts you to sleep, where you can't even be awakened even if you are going through a painful surgery. So usually it's used for major surgeries, and during this time we will have to maintain your airway as well and monitor your breathing, because you won't be able to do that as well as you would if you were awake. So we'll be watching you during that time. And then also we'll be prepared for any emergencies as well, because there is a chance that you could go into a deeper sedation that then we want you to go into. But we'll be prepared for that, and we'll make sure that we watch you, and yeah.
Okay, sounds good.
Wow! Thanks, Radhika, for teaching us about general anesthesia. Now let's go to Dr. Bravo, where she'll teach us about oral sedation.
Okay, so here are some pills for you. They're gonna help with anxiety and they may knock you out for a couple of hours. So go ahead and take all of this. You feeling okay? Oh my gosh, I think I might have overdosed her.
No Chris was hurt in the making of this video.
Okay, so oral sedation is going to help those patients with mild to moderate anxiety. It will not work for those that have very severe anxiety. What oral sedation is are some yummy pills that the doctors and dentists prescribe to their patients so that the anxiety could lessen once before their appointment. So oral sedation is used. It's a lot better than IV sedation, as in they're not poking your veins, they're not trying to kill you through IV sedations, and they're just some very yummy pills prescribed by your dentist. Okay, so the oral sedation takes 45 to 1 hour to get into your system, and then it takes 4 to 6 hours to get out of your system. Now, oral sedation, it does create a state of amnesia, so there's patients that will not remember what happened or where in the world they were at. For all they know, they were probably at a funeral when they were actually in the dentist chair. Now, for people with an oral sedation, they do not get to eat food for at least 12 hours. That's all I have for today for oral sedation.
Thanks, Dr. Bravo. Now we're going to be talking about IV sedation.
Okay, Natalie, so today we're going to give you some poison ivy to help you get your mind off of the needles and everything we're going to do today, just so you can concentrate on the itching, on the swelling, everything all over your body.
IV sedation is classified as general anesthesia. When you receive IV sedation, you remain conscious and should be able to understand and respond to the dentist. Basically, you go into a deep relaxation and don't care about what's going on around you. IV sedation produces partial or full memory loss and is classified as an anti-anxiety drug. Dentists and dental hygienists still need to numb their patient after the IV is given. Usually the IV is in your arm or the back of your hand. Ouch! Don't forget to take blood pressure before and after treatment. If your patient is scared of needles, you can use a topical numbing agent called Aim Top Cream. Don't give your patient IV sedation if they're pregnant, have an allergy to benzodiazepines, or intoxicated. Some pros of the IV sedation include a quick onset that's tailored to the patient needs, amnesia does occur and the gag reflex is diminished, and you can control the patient. Some cons include bruising on the arm or hand. It shouldn't be given if the patient wants to experience amnesia, and there's a longer recovery time and is more expensive.
Interesting. Let's learn more about electrical anesthesia.
Alright, Maddie, so today we're going to do some electrical sedation. So basically we're just going to electrocute you and you won't feel a thing.
Okay.
Alright. Are those for carbs? No, this is the new and improved electrical stuff for patients.
Okay.
Your hair's gonna be a little crazy for about 24 hours.
Okay.
If it doesn't go down, you need to come back to me and we'll do something about it.
Am I supposed to feel this funny after being electrocuted?
Yeah. It's not very fun, huh?
Thanks, Doc.
Hey guys, I get to be on Nye the Science Gal today, and I'm going to be talking about electrical anesthesia. And it's a really new idea, still going a lot of research, but I'm going to do my best explaining about it. So what it is there's a machine, and connected to that machine is a sensor. and we put that sensor in the area that we want to anesthetize. And that machine will send electric current waves to anesthetize the area. So some advantages, there's no needle. There's a slight pinch, but it won't have the pain that a lot of patients see when they see that needle and they get all that anxiety. The disadvantages, it doesn't really help with those deeper cleanings, big extractions, things like that. So really it's kind of a substitute for our topical anesthetic. But no needles, so that's the exciting thing about it. Did you get all that, Radhika?
Wait, what? No, I didn't.
Okay.
Wow. I don't know about you guys, but I had a blast learning about all the different local anesthetics. Well, that's it for this week's episode. Tune in next week when we learn about... Oh wait, we'll be on spring break next week.
Bill Nye the Science Guy.
Okay, it's a sedative drug that decreases activity, moderates excitement, and calms their symptoms. Decreases activity, moderates... Wait, what?
I'm gonna do my best in explaining it. But, so electrical anesthesia is a way to link, there's a system, okay.
Here's Alyssa, and she knows a lot about local anesthesia. Yes, you're getting closer.
Bill Nye the Science Guy?
Jill Nye the Science
Jill
Gal.
Nye the Science Guy! Cute!
Prescribed by your dentist.
I'm sorry.
You're fine.
I put my
Our special
apple
guest.
here because I didn't think anybody's in here while I was putting these boxes down.